When you're admitted to a hospital ward, it may not be immediately obvious if it's understaffed. But what if there was a notice, like there is here at Salford Royal Hospital, indicating the appropriate ratio of nurses to patients and the actual numbers of nurses and patients that day? This is the approach MPs say all hospitals should now adopt.
Decisions that are taken are put up on the notice board so people can see how many nurses, what level of qualification the staff on a particular ward in a particular day are. You make the system accountable, you make it open.
Alarm about nurse staffing levels has been reinforced by new statistics out today. Every ward's needs are different, but according to the Safe Staffing Alliance, the absolute minimum should be 1 nurse for every 8 patients. However, a survey of over 400 wards found 43% did operate with fewer nurses than that. The worst staffed were elderly care wards, which had more than 9 patients per nurse on average.
We found much poorer levels than we might have expected. I would have hoped maybe 1 in 10 or no more than that might have been at that level. And it's particularly concerning because when you get to 8 patients or more than 8 patients per registered nurse, you have an increased risk of dying in hospital.
The Royal College of Nursing says the government must take overall responsibility for ensuring hospitals can staff their wards adequately.
You can't, from central London, dictate what staffing levels on Ward 6C at Bury St Edmunds should be this afternoon. But what you can do is make sure that hospitals are using proper tools, that ward sisters and managers can pull in more staff when they need them, and that nationally you are training enough staff so there's a big enough pool of nurses for today and for tomorrow.
Today, MPs have called for a nationwide level of transparency on hospital staffing that goes way beyond anything suggested so far. But putting a notice like this in every ward in the country would be real proof the health service is adopting the new culture of openness it aspires to.